Thank you, Concora, for giving us this topic this evening. Deputy Michael Collins and Deputy Danny Healy-Rae have done enormous work in this. Thousands of people they've brought to Belfast to get this operation stop them from going blind, hips. I've had a number of people myself that they accommodated from Tipperary and got successful treatment. I think it's a scandal that the Minister is not here this evening, Minister Coveney or the Minister for Health, to answer this. No disrespect to Minister of State Fee, and it's a scandal. This has been kicked around in the head of a pin with the last several months because we're frightened. People are ringing now every day to try and get in before the 31st of January. We have all the bilateral agreements about everything else, and people can come down, and rightly so. And we're not, we seem to, this government seems to have an effort to stop this because they're embarrassed by it, and they'd rather let people go blind and be crippled with hips and knees and backs and scoliosis and everything else and tonsils, rather than accept what the good people, the good rural independent TDs are doing, their job to help people to get services they should be getting here. It's an embarrassment that they have to go above, and I think we have to have a clear and definite answer, and at least a month's moratorium for January to get people, because there's queues of people banked up waiting to go, and it's totally unfair to them. They're sick people.
Yeah, just for clarification, this has nothing to do with the Minister for Foreign Affairs. Minister Coveney is here. It's a matter for the Department of Health.
No, on a point of order, it is, and it is the Brexit. The omnibus Brexit bill should have embraced this, and it didn't.
We're dealing with it as a health issue, and Minister Feehan is here to deal with it, and I'm sure he's more than able to respond.
Thank you, Ken Corla. I'd like to thank Deputy McGrath, Collins and Healy-Rae for raising this topic. The Directive on Patients' Rights in Cross-Border Healthcare, commonly called the Cross-Border Directive, provides rules for the reimbursement to patients of the cost of receiving treatment abroad, where the patient would be entitled to such treatment in their home member state. The directive seeks to ensure a clear and transparent framework for the provision of cross-border healthcare within the EU for those occasions where the care patients seek is provided in another member state rather than in their home country. The EU Cross-Border Directive, which has been implemented in Ireland since 2014, has enabled many Irish patients to access health services in many other EU member states. Of course, our geography, proximity to Northern Ireland and the UK, means that the vast majority of Irish patients tend to access care in that jurisdiction. That is why the impact of our neighbours, the UK's decision to leave the EU, has a very real impact for our citizens. As the cross-border directive is underpinned by EU legislation from the 1st of January 2021, the revisions of this scheme will no longer apply to Northern Ireland and the UK generally. This is unfortunate and undesirable consequence of Brexit that is outside the government's control. But Minister O'Donnelly is acutely aware that patients and deputies are concerned about the loss of access to services in Northern Ireland particularly, which are accessed under the directive. As part of Department officials' Brexit planning, there has been extensive examination of this matter, which has raised a number of key policy and legal issues. Noting the importance the Department places on ensuring the Irish patients will continue to access this capacity, Minister Donnelly has tasked Department officials with examining the feasibility of implementing a unilateral cross-border directive-type arrangement to provide that Irish residents can continue to access services provided by private health service providers in the UK post the end of the transition period. That work, which is detailed and complex, is still currently ongoing, but I would like to reassure deputies that it is Minister Donnelly's intention that Irish patients should be able to benefit from accessing these services in the future. I think it is also important to restate that patients will still have recourse to access health services under the EU Cross-Border Directive scheme in 30 other countries from the 1st of January 2021.
Minister Feehan, but Minister Donnelly should be here to answer this. He runs like a scalded cat every time we have a question or a motion down to talk to him. It's a total disrespect to the rural independent group. A scalded cat wouldn't go to Skylight as fast as he's gone. And he's like snow off a ditch other times. The answer you gave us there, Minister, is pretty condescending to old people. The lads here, my colleagues, bus people to the north. Unfortunately, we have the technology that the buses will travel on water to go abroad. And to tell people they can go abroad, and to tell people now in the 11th and a half hour that you're looking at a bilateral agreement. You had 2 years to do this. You never accepted that Britain were going to go. You should have and be ready. So we're closing the gate when we're closing the stable door when the horse is bolted, and well bolted. We want certainty. We want to know that people can go. First of all, these people should be treated in Ireland, and it's the Irish taxpayers that pay for it. It's a mockery that they have to go there, but the opportunity was there, and I want to thank Niamh and all the staff in Kingsbridge Hospital who have been so helpful. And as I said, Deputy Collins and others that organised it, and the staff in Deputy Collins' office who run around in the middle of the night picking up people to bring them to a bus in Cork.
Right.
You have no idea the effort that goes into
Thank
it.
you.
But what is worth it because people can see, and they can stand up, and they can walk, and they can live some modicum of life. So this is not acceptable at this point in time. It should have been in the omnibus bill.
Thank you very much. Minister, can you conclude on this important matter?
Thank you, and I fully understand the reasons why the deputies have raised this issue here today. The decision of our neighbour to leave the EU will have unfortunate negative implications for Ireland that are outside our control. With the loss of access to healthcare services currently provided for by the cross-border directive representing a substantive and real loss of access to healthcare services for Irish people. However, as I said, Department of Health officials are continuing to examine this matter with a view to ensuring that access to services in Northern Ireland and the UK might be retained in 2021. Separately, I think it is useful to note that we have a memorandum of understanding with the UK that will be signed shortly, which will ensure continued access for Irish residents to essential healthcare in the UK post the end of the transition period. This is a very positive outcome in terms of Irish and British governments' commitment to maintaining, insofar as possible, the current healthcare arrangements under the Common Travel Area. In addition, on behalf of Minister Donnelly, I want to assure deputies that both the Irish and UK governments are fully committed to continuing existing cross-border health services like the cardiology and cancer treatment services in Altnagelvin, Derry, and paediatric cardiology and related maternity services in Dublin, and to ongoing health service cooperation into the future. Finally, Minister Donnelly will keep deputies updated on progress in relation to Department officials' examination of the feasibility of implementing a unilateral CBD-type arrangement.